Welcome to our introduction to exercises. My name is Dr. Stephen Simonetti, and we just want to go over some basic things about exercise and the importance of them and the sequence of when to do them and how to do them. Number one, the when. It's important, and exercise physiology will tell you this, to have a good, strong foundation before you begin any exercise program, especially for your back or your spine. Meaning, when you exercise, if there's an imbalance, the strong muscles get stronger quicker than the weak muscles. And this is why exercise programs generally do not correct pain modules or different things that people are dealing with structurally, because again, you need to have a good foundation. When you build a house, you put a good foundation, then you build the walls. So please start the exercises when we instruct you to. Even though they are posted on our website, they really should be initiated after your spine is in better balance, and that comes through chiropractic care and allowing the spine to work more evenly side to side through the adjustment. Number one, you also want to make sure that your exercises are never done in bed. If you're on the floor or recumbent, you're always on a carpeted floor or a firm surface. You also want to warm up, and one of the modules you'll read is about warming up with banging the gong or walking in place. You want to get your muscles some oxygen and water and nutrients before you start doing the exercises. If you're going to do strengthening exercises, you should always have a good cardiovascular base, meaning if you're going to lift weights, you should always do some aerobic cardiovascular exercise for several weeks to maybe a couple of months before you actually start doing strengthening exercises, because you do want those muscles to get strong, and you want them to be able to get a good blood supply, and upon demand that your cardiovascular system is very efficient. So there are three types of exercises. Number one is cardiovascular, number two is flexibility, and the third is strengthening or weight bearing. The older we get, the more important it is to do weight bearing exercises for a couple of main reasons. Number one, as we age, we lose our muscle mass, and muscle burns in metabolism quicker than anything else in our bodies, any other tissue, fat tissue, etc. So we tend to gain more weight as we lose muscle mass as we age. So it's important to put that muscle mass back on. Flexibility is very important. You know, the yogis believe you're as old as your spine. They live to 150 or thereabouts. They take great heed of their spine, and that's what needs to be most flexible. Specifically for the lower back exercise programs we are going to teach, there are three things you want to make sure we're doing. One is keeping your low back muscles stretched and very limber. Two, your hamstrings or your back of your legs need to be very loose, and so they have some good tensile strength. And then we want to strengthening your core. Not necessarily your abdominals. A six-pack means nothing if the core musculature down deep is not strong. I find if I do not exercise first thing in the morning, it doesn't get done. You need to make it a routine. Most of the low back exercises should be done at least once or twice a day, although some of the postural and ergonomic things we're going to recommend can be done throughout the day. For example, when you're sitting at your desk and you're in this forward head carriage, pulling your head in and then looking up at the ceiling for 5 seconds every 15 minutes. So again, breathe when you're doing the most vigorous part of the exercise. You're breathing out through your mouth. You breathe in through your nose upon the relaxation of any exercise. Also, when you're expanding, say we're doing the butterfly and the Straighten Up America exercises that are on our website here, you're going to pull in, and as you breathe, as you expand, you breathe in. When you contract, you breathe out. So that's always the breathing with any type of exercise. So again, welcome to our world of exercise, and how it supports chiropractic care is essential. So we ask that you're real diligent with this, and again, we thank you for allowing us to help you in the Cross Island Chiropractic Wellness Center.